All right, let's dive in. Every single day, most of us use GPS to get around our cities, right? It's second nature. But what if a surgeon could use that same kind of tech to navigate the most complicated terrain imaginable, the human body? Well, that's exactly what we're talking about today, the surgeon's GPS.
Just think about that for a second. A surgeon needing to get a tiny instrument from your groin all the way up to your heart or your brain through a maze of arteries. What if they had a screen, just like the one in your car, showing them exactly where they are, where they're going, and the best route to get there? It sounds a little like science fiction, doesn't it? But it's not. It's very real, and it's happening right now.
You know, for most of history, surgery was pretty straightforward in one way. You made a big cut, so you could see exactly what you were doing. But modern medicine, for good reason, is moving away from that. We want smaller incisions, faster recovery. But that creates a huge new challenge. When you're working through a tiny little keyhole, how in the world do you see where you're going? How do you navigate?
This slide really just lays it all out perfectly. On one side, you've got open surgery. It's like popping the hood of your car. You can see everything, you can touch everything, simple. But on the other side, minimally invasive surgery, that's a whole different ballgame. It really is like building a ship in a bottle. The surgeon is guiding these long, thin tools called catheters through your arteries, watching their every move on a screen. Their eyes are on the monitor, not the patient.
So, faced with this problem of navigating totally blind, surgeons needed some kind of map. And the very first version of that map, the first breakthrough, was basically a form of, well, X-ray vision.
And this was the machine that made it possible, the portable C-arm. I mean, this thing was absolutely revolutionary. For the very first time, it gave surgeons a live, moving X-ray video inside the operating room. They could actually see a 2D shadow of their tools moving through the patient's body. This was the original roadmap, and it pretty much created the entire field of endovascular surgery. But, that first map was, let's be honest, it was pretty basic. Imagine trying to navigate a huge, complex city using a flat, sometimes distorted drawing. That's kind of what this was. You're looking at a 2D picture of a 3D reality. But that wasn't even the biggest problem, not by a long shot. The biggest issue is the constant X-ray radiation, for the patient, of course, but also for the surgeon and everyone else in that room. And that danger was incredibly real. Just look at this number. A survey found that almost half of new surgeons in training had no formal safety training on radiation. I mean, that's wild, right? They're using this critical tool every single day without fully understanding how to protect themselves and their patients from the risks. It was a massive wake-up call that something had to change.
And that big push for change is really guided by this one crucial principle, ALARA. It stands for as low as reasonably achievable. It's kind of the prime directive in this world, a constant reminder to do everything humanly possible to lower the radiation dose. This idea, ALARA, is really the engine that drove all the amazing innovation that we're going to talk about next.
So to tackle the problems of that portable C-arm, the first move was a huge hardware upgrade. We're not just talking about a better tool, we're talking about building a completely new surgical environment from the ground up, a true high-tech command center.
And this is it, the hybrid operating room. And it's exactly what it sounds like. It's a fusion. It has all the gear and sterility of a classic OR for open surgery, but it also has the power of a state-of-the-art imaging lab built right in. You get the best of both worlds with zero compromises.
And this is what makes it such a game changer. That C-arm is no longer some portable machine you wheel into the room. It's this massive, powerful, fixed system that can be mounted on the floor, the ceiling, even on a robot. It's way more precise and, this is key, it's powerful enough to create detailed 3D images during the actual surgery. This room is the foundation on which our GPS is built.
Okay, so the hardware is in place. The command center is built. Now it was time for the software revolution. It was finally time to turn on that true, real-time GPS inside the human body.
And here it is. This is the absolute magic. It's called image fusion. What the system does is it takes a super detailed 3D map of the patient's arteries from a CT or MRI scan done before the surgery, and it digitally lays it right on top of the live low-dose X-ray image in the OR. So all of a sudden, the surgeon isn't just seeing a flat gray shadow anymore. They're seeing their tools moving in real time on a rich 3D color map.
So how does this work? It's really a pretty simple three-step process when you break it down. Step 1, you get the map. That's the high-res scan you do before the procedure ever starts. Step 2, you get your real-time location. That's the live, low-dose X-ray showing where your tools are right now. And step 3, the software does the magic. It fuses them together. It lines them up perfectly, giving the surgeon one dynamic, color-coded roadmap to follow.
So what does all this high-tech wizardry actually mean for a patient? Well, it means pretty much everything. With a clear map, the surgeon doesn't need to take constant x-rays to check their position, so the radiation dose plummets. They also use way less of that contrast dye that can be tough on the kidneys. And of course, the procedures get faster and the precision goes through the roof. It's safer, it's quicker, and it's just plain better.
And what's really cool is that this GPS isn't a one-size-fits-all deal. The map itself can be personalized for the patient's safety. For most people, that map comes from a CT scan. But let's say a patient has kidney problems and can't handle the normal iodine dye. No problem. The surgeons can use a map from an MRI instead, which uses a totally different agent that's safe for the kidneys. The destination is the same, but the system finds a safer route.
Okay, so we have our GPS. The system is active, it's in hospitals right now, and it's fundamentally changing surgery. But you know how technology works. What's next? What does the road ahead look like?
Well, even with all these incredible advances, we're still using that low-dose X-ray to see the tools in real time. So the next great challenge, the true frontier, is to get rid of radiation altogether, to go to zero.
And this technology, this might be how we do it. It's called Fiber Optic RealShape, or FORS. Now, instead of X-rays, this tech uses hair-thin optical fibers that are built right into the surgical tools. By shining light through them, the system can reconstruct the full 3D shape of the instrument in real time. The key phrase here is guidance by light, not radiation.
And that is a profound shift in thinking. We are talking about going from seeing a flat, black and white shadow of an instrument to seeing the actual, full, three-dimensional shape of that tool as it twists and turns its way through the body, all with absolutely zero X-ray radiation. It's incredible.
Okay, so imagine we have a perfect radiation-free map. What's the final piece of this futuristic puzzle? Well, what if the car could help drive itself? And that's where we get into the amazing world of catheter robotics.
Here's just a quick snapshot of where this field is at the moment. You can see a few of the big systems in development. What's interesting is that right now, only one is approved for these types of vascular procedures, and it doesn't have that advanced imaging fully baked in yet. But look at the trend. All the new systems are being built from day one to merge robotics with imaging. That is clearly the future.
And this right here is the holy grail. It's called assisted navigation. The idea is that a surgeon sits at a console, plots out the safest, most efficient route on that 3D map, just like you would on Google Maps. Then they hit go, and the robotic catheter navigates that path with a level of stability and precision that frankly no human hand could ever match.
This tech is already transforming how we treat blood vessels. But just step back for a moment and think bigger. A precise, radiation-free GPS that can navigate anywhere inside the human body. Imagine using it to deliver chemotherapy directly to a tumor and nowhere else, or to perform delicate repairs on a beating heart valve, or even for neurological procedures deep inside the brain. What other fields could this change forever? The possibilities are just starting to open up.